Welcome, everybody, to episode 60 of the Mental Health Hour, uh, broadcasting live on Twitch. And you can catch any replays right here on Twitch or over on our YouTube. Um, but more information on all that. Mic check from Tony D. How you doing, Tony?
Mic check, mic check.
Good to see you. I know you guys are getting ready to go live as well. And Tracy is in the house as well. But yes, please, guys, if you aren't already, or if you're just stumbling onto this on the YouTube or anything like that, please, and you like the content, go ahead and share it out. Give us a follow, subscribe, like, all of that good stuff that helps us grow as a show or a podcast. Um, and yeah, the biggest thing that helps the most is sharing it out. Let's build the audience up as we're doing slowly over the course of a year now, or over a year. Crazy to think, but yeah. So tonight we will be getting back into medication, the importance of medication, and just want to cover a few more things as if you were here with us or you caught the replay, Penelope my daughter had a meltdown in the middle of the show. So I didn't get to really talk about all the stuff I would like to have covered. Gemma did a good job covering one of the main things, and that was mixing medications. Good evening, Michael Joseph Murray. How are you, sir? Yeah, mixing medications. So if you're on a number of pills, how they interact with each other is different for everyone. So my personal medications, the meds that I'm on, might not work for Gemma. She's over there. Speaking of Gemma, how are you tonight, Gemma?
Not too bad. We're on the 6-week holidays and we are in week 2 of 6 weeks off, and I am ready for him to go back to school.
Yes, indeed. It's coming up. I took the twins to their high school orientation this morning. So their school starts on the 17th of August. So
we've got
coming
September.
quick.
You break up earlier though, don't you? They break up earlier. We go right through.
Oh, yes. Yeah, they go at, I think high schoolers go at, I think they get picked up at 6:30, I want to say. Or they go to the bus at 6:30 and get picked up at 6:50. I don't. It's something.
No, but I mean they break up later. Like they didn't break up here till July.
Oh, yeah. Yeah, they were done in beginning of June, maybe mid-June. But yeah.
So yeah, you've got a lot longer off. Oh, I can only just cope with 6 weeks. No, thank you. Oh dear.
It's it seems to fly by. I think the same thing. Like, man, this house is going to be on fire for the next 3 months, but it goes fast, and we have a good time. We get vacation in there, and yeah, it goes really fast. And they'll be back in school, and then we'll be looking at each other like, well, what do we do now? So, anywho, I do have a full house tonight. All 3 of my stepkids are here, and of course, Penelope is with us as well. She is, for the moment, sound asleep. So let's take advantage of that.
Don't say it.
Let's get some good content in before she is due for a bottle at 7. So I'm sure we'll be hearing her calling at some point. One of my stepdaughters is keeping an eye on her though. So,
very good.
That being said, we will go ahead and get started. Well, pick up where we left off, and that was with kind of all of the we were talking about all of the different topics about medication, obviously, and I'll go ahead and bring it back into the mixing the meds real quick, um, because that has been a problem for me, and it's something to definitely be aware of, um, whether it be you're not feeling right yourself, or a friend, wife, husband, coworker, somebody you know well. Gemma, in my case, has told me before something seems off, and I have returned the favor. I've told her she seems a little off tonight. When you know somebody and your friends like that, you can sense that, you get
Mm-hmm.
that vibe. So when meds are not interacting well with each other, which is a common thing, and it happens to a lot of folks that are on a regiment of meds, not just like one thing. But we will get into other mixing. Um,
Mm-hmm.
the um, the medications that you are on, if they are mixing inappropriately or not working well together, then it needs to obviously be brought up to your doctor's uh, attention so that things can be balanced out, or we can try another direction. Um, I personally, and I told this story last week, but I can't remember now if it was in the midst of the crying or what have you. But I did have an experience. I've had two experiences now with medications not cooperating. Most recently, um, back around the time we did Tracy's episode, I was just starting a new medicine, and uh, it was kind of, it made me like queasy at first. Uh,
Mm.
get that raw stomach, which is common for a lot of meds and vitamins and stuff. You got to take a lot of these with some food so it doesn't give you that raw gut. But the it soon went from just like a queasy stomach to kind of feeling completely out of it. And I had to talk to my doctor, and luckily he was able to get me in the next day because I couldn't I couldn't keep taking the same medicine. Something was clearly off. Gemma saw it. My wife saw it. Um, and so we went in, we talked, and that one was kind of easy to pinpoint because that was the new medicine or the new medication,
Yeah.
and everything up until that point was uh, working just fine. So we came off of that and tried something else, and I feel much better for it. So that's just a little experience there. I told a story last week, and I won't get into it again, but um, in part one, I told a story about a few years, well, I guess it's been maybe 10 years ago now, where some medicines weren't mixing well. And
Mm.
it was kind of a similar situation, but I feel like it was a lot worse. But I mean, and the effects of that can vary. I mean, it's not just being out of it like I felt. Like it can be a multitude of different side effects and stuff. Gemma, you were telling us, weren't you, about your experience?
Yeah, yeah, I've had loads of different side effects with different medications to the point where like I've had milder ones to quite severe where I've been hospitalized with them. So it depends on the medication and like what you're on, and if it's like just a just a disagreement with that particular medication, or if it's a disagreement because of a other medication as well, because you can get them where they counteract with each other and
Mm-hmm.
cause their own problems as well. But yeah, I've had like severe like
Yeah.
vomiting, headaches, heart palpitations. Oh, horrendous! Totally spaced out, zoned out.
Absolutely.
Loads and loads of different things.
Yeah, it's definitely the spacing out kind of thing for me,
Hmm.
um, the most. Um, but that can be like I said, like we've talked about, that can be fixed pretty quickly by talking to your doctor. Now, one thing I will mention, as I already hear Penelope, um, uh, one thing I will mention, and I've talked about this before on other episodes. And by the way, before we get too deep, I wanted to say hello to everybody else coming in. Hattie, good to see you. Eric, nice to see you. Annie, everybody, good to see you. And Hattie, our mod there, is um, throwing up the new ad for this week and for the rest of this month. We're getting ready and gearing up to do another live Q&A. This will be on August 31st. So end of this month, please, guys, share it out. The graphic for it is on the Mental Health Hour Twitter page. You can find that obviously in the bio link. And share it out on your pages. If you know anybody that wants to ask questions, we don't discriminate. Send in all questions mental health related, as always. I always say we're not going to predict the Super Bowl winner or anything like that. But yeah, any mental health related questions, and keep it appropriate. Let's not point fingers, call anybody out, because we're not going to say any names. This is completely anonymous. It's worked for 3 episodes now of this, and everybody seems to enjoy it. Isn't that right, Gemma?
Yeah, definitely. And if I try and read them out exactly as they're written, so that we understand the question. However, if there are names in there, I will take them out, and I try and degender the question so it's applicable to everybody. And if it is about someone, then it takes that, is it that person, out of it, just to make it fair for everybody.
So there it is. August 31st, end of the month. We'll go over this again at the end of the show. But we can, that graphic will be obviously on the replay. You can scan the QR code there, and it'll take you right to the question form. Or Hattie is dropping the link in the comments for us as well. If you guys have a question, it can be about anything mental health related at all. Please send it in. It's completely anonymous. We cannot, there's no way we can know. It's done by Google Docs. So there's really no way you can even write your name, but we still don't know that it's you. So there's no true way for us to know exactly who it is. It's completely anonymous. Unless you were to type a PIN number in or something, and then identify yourself by that PIN number, then I guess we would know. But other than that, we'll get back into the meds conversation. I did see a question. Funny, I've never had a problem with anti, even when they said told. So yeah, we'll get into a little bit of that as well. I wanted to cover that, but going back to before I sidetracked and talked about our upcoming special. I've talked about this on the broadcast before. It's very important, and I believe it to be one of the best pieces of information I got in my journey, and that is that when you're dealing with psychiatric meds or antidepressants, anti-anxiety, anything that is going to be considered, I guess, a mental health related drug, anything for your brain, you should schedule yourself an appointment with a psychiatrist. That is a doctor of medicine, just like your doctor, only he's a psychiatrist, but he can prescribe medication. The difference between a psychiatrist and a psychologist or a counselor, the psychiatrist can prescribe medicine. This is the person to talk to about your brain meds. You want to talk with this person, get their diagnosis, and get their medication suggestions. And then after you see them, there may be a follow-up appointment. How are you doing? Are you feeling out of it? Should we shop around? Should we fix anything? Or are things getting better? Are they getting worse? so you'll have that follow-up appointment, and then you can take all refills and everything to your general care practitioner. So your normal everyday doc that prescribes your meds will be able to refill that for you. But at least you've gotten the diagnosis, and the initial meds were done through a psychiatrist who is, his profession is the mind and the brain. So his or her, sorry, or their. Would you agree with that, Gemma?
Yeah,
Or
definitely.
anything else to add?
Just where you're getting like back to where you get the prescriptions and stuff from, and I know that it's been mentioned in the comments about specifically like anti-anxiety, antidepressant medications. I know that certainly a lot of my antidepressant and anti-anxiety medications have come from my GP. If you get some that don't like go with you, don't just think they're not going to work. Those medications in particular are not a one size fits all kind of medication. They can tweak the dose, they can tweak the medication. You might need something completely different altogether. Don't give up on them completely. If you're struggling to find one that fits, you are generally best going to somebody that's specifically for that thing, like depression and anxiety, rather than a GP who is, in the nicest way of putting it, the jack of all trades. They deal with everything. Whereas
Exactly.
if you need a specific medication, you're best going to like the source. Like, for example, if you need a new plug socket in your house, you would go to an electrician. You wouldn't go to a plasterer, for example. You go to the person that deals with that and that have got more knowledge in that field. So you can get a better overall treatment for that. So don't just give in thinking it doesn't work if you've not had much luck. I am one of those people that have had to sample many, many different medications because I haven't had much luck with them.
Right.
So yeah.
Yes. So I wanted to hit that first. That was one thing that I was, when I was editing last week's show for the YouTube channel, I saw that come up. Or I saw that I never brought that up, and it was one of the most important tips that I've learned in my time, and it's really done me well. And I mean, I have a great relationship with my primary care physician. He's been my doctor since I was a baby, and knows me well, but you want to get that, as Gemma said, he's a jack of all trades. The psychiatrist is trained specifically in the brain. So that being said, I want to take this moment to go ahead and put on a little video. It's about 5 minutes long, but it covers some myths about psych meds and what have you. Some hot topics that I feel like a lot of us have heard when it comes to psych meds or what have you, about them, and what they can do, what they can't do, and etc. But I don't want to give too much away. Let's hop into this video real quick, and we'll be right back to discuss it after it is finished.
It's not always easy being a college student. Some of the top 10 impediments to learning is related to mental health, such as stress, anxiety, and depression.
Over 9% of college students in the USA seek professional help regarding mental health issues, and only 24.5% of students take psychotropic medications.
Unfortunately, there are a lot of stigmas and myths regarding taking psychotropic medications, which can impede students from getting better.
So, what is true and what is false?
I'm Dr. Robert Lindstrom, and I'm the psychiatrist for Counseling and Psychological Services at California State University, Channel Islands. I've been practicing psychiatry since 2003, and I have a lot of experience in both inpatient and outpatient settings, as well as in emergency psychiatry. I'm here to answer some questions and challenge some common myths about psychiatric medication.
Only the crazy or the weak take meds to escape their problems.
If you were feeling sick and went to your doctor, and if your doctor said you had an infection, then prescribed you antibiotics, would you say to yourself, only the weak take antibiotics to cure an infection? Of course you wouldn't. Psychiatric disorders are just like physical disorders. They fit commonly understood diagnostic criteria, have a biological basis, and can be treated with pharmacological interventions.
If I take those meds, I will get addicted to them.
While it is true that there are a small number of medications used by psychiatrists that do have a potential for addiction, psychiatrists are very careful when prescribing them and monitor very closely. The overwhelming majority of psychiatric medications used today are not dependence-making drugs. After all, physicians want to improve problems for their patients, not create new ones like addiction.
I'll become an emotionless zombie if I take psych meds.
Taking psychiatric medications will not turn someone into a mindless, emotionless zombie, nor will they cause their personality to change or turn them into someone they are not. And if changes like this were to happen, they would be seen as undesirable side effects that would prompt a change in medication. The goal of medication is to improve troubling symptoms, not create new ones.
Wait, hold on. They should make me feel better right away, right?
Unfortunately, this is simply not the case. Psychiatric medications are neurochemicals. Their effects on the central nervous system happen at the cellular level, and these changes take time for their effects to be seen and felt. As an example, I commonly tell patients that it takes 2 to 4 weeks before the effects of most antidepressant or anti-anxiety medications are seen. This means that both patience and persistence in taking the medication are necessary to get a desirable outcome.
I can stop taking my meds once I start feeling better.
But people with diabetes do take medication every day to keep their blood sugars normal, and people with high blood pressure do the same to keep everything in control. The variety of psychiatric disorders follow a similar pattern. Some disorders are more short-term, for example, adjustment disorders or first episode depression, and treatment with medication may last for 6 to 12 months. But other disorders are more chronic, for example, recurrent depression, bipolar disorder, or chronic anxiety, and treatment may be much longer term, possibly even years, in order to maintain healthy, happy functioning.
I hear that the side effects can be pretty awful.
Every substance we ingest has the potential to cause side effects, and psychiatric medications are no different. However, antidepressant and anti-anxiety drugs, the most commonly prescribed psychiatric medications, are usually well tolerated, and when side effects do occur, they are often short-lived. And when side effects do become a persisting problem, psychiatrists can often make adjustments or changes to reduce or eliminate the problem.
I'd rather use natural methods, like smoking marijuana.
Marijuana or other ingested cannabis products have yet to show significant medical value in legitimate studies. Furthermore, legitimate studies do show negative effects of cannabis on psychiatric symptoms, including anxiety, depression, and psychosis. I hope you found the answers to these questions to be helpful. If you need more information or want to schedule an appointment, please call CAPS. We would be very happy to help.
All right. I thought that was a good video I wanted to share with you guys. The credits for that video will be in the description of the YouTube channel. If you want to learn more from them, they have a great YouTube channel. And yeah, I knew, Jim, welcome. I wanted to try and get it out of the way before. I want to get the elephant out of the room. Jim and I don't agree with, everything that we put on. If we take a video from, I've heard a lot of great things. And of course, we've talked with Jim on this show about medical cannabis and the brilliance that it has done for a lot of folks. So that last one was kind of more an afterthought. But the first 5 of them, I really thought was poignant and a good discussion piece for this particular episode. that we are talking about. What do you think, Gemma?
Yeah, and I think with the cannabis, it depends on your reasons, personal reasons for taking it as well. Certainly in Jim's situation, where there is a desperate need for that, where it can significantly improve someone's life, then definitely. There, over here, it's not as accepted by the medical system, but it is starting to get in there. But yeah, definitely a lot of good points in that video.
Indeed. And we're having our first meltdown of the show. So we made it. We made it. 26 minutes tonight. Guys, as Hattie is dropping in, please take a look at her comments. She usually includes some links for you guys if you want to participate in either the Discord, the bio link, the forms for the questions. Tracy's got it, or Tracy, Hattie's got it all there in the chat for you. Please feel free to ask her any questions as well. And she also had never be afraid to ask your doctor questions, specifically if you're having an issue or concern with what you're taking. There are usually alternative meds you can try. Also, request generics if available, and look for coupons when your insurance doesn't cover them. And that's a good point. A lot of mental health medications, counseling, psychiatry, all that stuff are not well covered on most United States insurance plans. We'll get Gemma's take here in a second on the UK, but our health insurance just has not really caught up with the times there, and that I believe has a lot to do with the older generations have grown up not talking about these things, and it's becoming more normal and more efficient. People are seeing great turnaround from talking about their mental health, and so it just hasn't really caught up. I know my insurance provider from my work is really getting the ball rolling with improving their mental health options as far as coverage goes for those reasons. They even sent me a survey to fill out because I had a claim on it, and they wanted to know more about my experience with the insurance and what could be better. So, Gemma, how is it over there in the UK while I go check on the...
It's always been like a taboo kind of subject as mental health. And I think that a lot of places don't want to cover mental health because, unfortunately, it's down to profits. And there's a lot of people that do need mental health support. And it's awful when they put profit and money over people's health and well-being. Now, here in the UK, we have the National Health Service, the NHS. However, and I don't want to knock the NHS because they have actually been extremely beneficial when it comes to Thomas's health, getting him through the cancer and some of my conditions. However, mental health wise, yes, there are services that will give you mental health support. However, I have found myself, and this is from my personal experience, it may differ from person to person again, but because I have had a history of self-harm in the past, there is one thing called IAPT, which is your lower end mental health support, which you can refer yourself to. There is a huge waiting list usually, and you can refer yourself to those. Now, they won't entertain me because I have tried to end my life before and I've self-harmed. So they consider me too high risk. The next level is like going through the hospital or the higher end sort of help. However, I'm finding myself where they won't help me either because I'm not actively trying to end my life. So I'm right in the middle of both. I'm not high risk enough for one, but too high risk for the other. So I fall right in the middle. And I've got I have like a hospital insurance plan, but it doesn't cover mental health. That's the problem with me as well. So I'm getting currently private mental health support at once a week at the moment. But I mean, there is routes you can go down, but it takes a very, very long time over here to get referred, get onto it, and get seen by the appropriate people. So it does exist, but it just depends how soon, how urgent you think it is for that kind of thing. There is private medical insurance and things. We have Bupa, Spire hospitals as well, so they're private hospitals. We have all that, but again, for people that want to pay for that, you can generally get in quicker. But otherwise, if you go down the hospital, then the national health route, you're going to be waiting months, if not years. And there is actually a big, they say, crisis around mental health here at the moment, where there isn't the support. There's lots of helplines and things, and the charities are taking the backlog from the hospital, and what they're not able to keep up with. But as with everything, it all comes down to money, and not enough money, not enough people, not enough everything, basically. So yeah, that's the situation.
Indeed. And it looks like we might have our very first broadcast where I'm feeding Penelope, because I think she's hungry. It is about time. She should be due at 7, but she's
She
pretty
wants
upset.
it early. She knows what she wants.
We're gonna get into some slides while I make a bottle, and
Mhm.
I want Gemma. You can go ahead and take control. Just Med 1,
Okay.
Med 2. Go over those first. I'll throw the first one up there. This right here is about mixing. This is just Xanax and alcohol, and I said we were going to get into mixing meds of another way, and that's what this is: mixing with
Mhm.
alcohol. And I'll go over something once I get her bottle ready.
Yeah. Xanax is a medication that you can't get here from the hospital. I believe it is available via private prescription. However, you cannot get Xanax from the hospital through a regular NHS prescription. It is private only. So the dangers of mixing Xanax and alcohol. Xanax and alcohol are both C and D depressants that affect the same chemical in the brain. This makes them a dangerous combination that can result in the following symptoms: respiratory depression. Xanax and alcohol both lower respiratory rates. This could result in dangerously shallow breathing and a lack of oxygen. So I don't know if you've ever been to the hospital where they put the thing on your finger and it gives you an SpO2 reading. It needs to ideally be above 95. Generally, they will accept anything above like 94, 92 at lowest, but anything less than that, not good. And then unconsciousness. Mixing benzos like Xanax with other depressants like alcohol can result in a comatose unconsciousness. So, oh dear me, let me just shut that up. So yeah, definitely. We know we've spoke about alcohol a lot of times before, where we've said about how alcohol is a depressant on its own. So if you're mixing those things, it just exacerbates things even more. So let's have a look at the next one here. This one. Right. Dual addictions. Both alcohol and Xanax can cause physical dependency and addiction. Oh dear me. Sorry, that was my phone now. It's all happening tonight. Both alcohol and Xanax can cause physical dependency and addiction, leaving the body dependent on multiple substances. Blackouts. Mixing benzos and alcohol increase the risk of blackouts or not remembering actions that took place. An overdose. Alcohol and Xanax strengthen one another. This means it takes much less alcohol to overdose than when drinking without Xanax. So if you're taking Xanax and the alcohol, it will multiply the effect of the Xanax and the
And
alcohol.
that is absolutely true. Coming from a former, well, still an alcoholic. I mean, you're never a former alcoholic. You're always an alcoholic. But I did drink on my antidepressants.
Mhm.
Obviously, I did because I've been on my antidepressants since I was 25, 24, 25. And
Mhm.
I, of course, was drinking quite heavily. And I always wondered why they weren't working. Uh, so go figure. Now, this is, like I said, this is about Xanax, but it was the only thing I could find that had the information. A lot of
Mhm.
this translates to the different medications
Yeah,
that were
it would be
discussed.
applicable for all.
And so yeah, where did you leave off? Did you make it through?
Yeah, I finished those
Okay.
ones.
So important things to think about. Well, number one is the name of our broadcast tonight and last week, the importance of medication. It's not
Mhm.
so much that we, Gemma and I, or the Mental Health Hour, it's not so much that we are pushing for medications, um, saying that you need to be medicated. No, no, no. Everybody has their own program plan of attack and situations like that. Um,
Mhm.
the importance of medication. If you are on medication, um, there's a lot of important things to discuss with mental health or psych drugs. It's coming. It's coming.
Mhm.
So I wanted to add that little bit in there. And
Mhm.
as we get started feeding Penelope here, the other thing to discuss from the final slide of the evening,
Mhm.
and I'll go ahead and throw that up, and you can. It's a quick one, and we just kind of went over it. Is why antidepressants stop working. So go ahead there, Gemma.
Yeah, so it's
Thank you.
increased stress, interaction with a new medication, substance use, age, and medical conditions like MS, for example. That's one of them. There are others that can mean that it needs to be changed or stops working. But another one that's, I don't think it's on there, that they can stop working, your body actually becomes like tolerant to it, where if you've been on it for that long, it stops being as effective. I know with my pain medication, I started on a much lesser dose than what I'm on now because I've been on it that long. My body needs more to get the same effect as what it did do when I first started on a lesser dose. And it can do that. Your body can get used to it. And especially with like antidepressants, once you've been on them for a while, as awful as it is to finally get something that helps and works, eventually it's going to not be as effective. So it's about
Exactly.
going back and talking to your doctor, telling them that it's not as effective as it was, and maybe looking at changing it. There's nothing to say that eventually you can't come back to this one, but that doesn't mean it's going to work the second time round for you. It's just about changing it and finding another one that helps.
Exactly. And as Espresso points out, problem is most therapists treat people as one size fits all, which
Mm.
and that's what we were kind of getting at with the primary care physicians or GPs. Um,
Yeah.
they are very much one size fits all. This is what I know about depression, but I also know how to fix a broken foot, etc. You know what I'm saying? Um,
Yeah.
so yes, you can find some of that more so with your primary care. That's why we stressed about seeing a psychiatrist, somebody trained in prescribing medicines for the brain.
Yeah.
Um, Antidepressants as a whole kind of have that. Uh, I know from I've been on Zoloft or sertraline for a
Mm.
good while, and it works for me. But you have to, and I've talked about this on the show as well. you have to constantly be on top of how your body is tolerating it. You build a tolerance to these drugs. At least that's the way my doctor explained it to me. Like, we have to up by 25 milligrams occasionally if you're not feeling the effects as much anymore, or it feels like it stops working, as that slide just had on there. So antidepressants can definitely be one of those things that we were kind of getting into last week about keeping on top of your medicines. Very important. And I don't remember, Gemma, do you have any antidepressants that you take, or are you?
I did. I haven't currently. Well, I do, but it's not for depression. It's a very old antidepressant that can help for that, but it's not. It wasn't prescribed for depression. Currently, I'm not taking any antidepressant for the simple reason that I haven't been able to get an appointment with a psychiatrist or somebody that prescribes medication other than a GP, and it just wasn't working for me. So I thought it was best to hang fire rather than going through multiple different ones, having loads of different problems. I'm hanging on until I can get my appointment. That way I can get one that's right for me rather than completely messing up my body and being given ones that counteract with each other, because I actually had that. My GP prescribed one. And when I was looking into it, and it said, do not take if you are on like X, Y, and Z. And I was on 2 of them. And I'm like, well, my doctor clearly didn't look that up, which is what we're saying about GPs are used to dealing with a huge variety of things. And they're like a kind of, it with no disrespect to GP, but it's like a jack of all trades.
Yeah.
They have to deal with everything. The one patient can walk in and they've got like a pain, like a shoulder pain, back pain, whatever. The next person can be something to do with digestive problems. The next person can be a broken bone, and they get sent to the hospital. They have to deal with so many different things, which is what I said about how if you need a new plug socket, you'd go to an electrician because they specialize in those things with electrics. Whereas if you need something, especially something that can affect not just your mental health, but your whole body, and mental health, if you haven't got the right medication and it's making you feel like worse, it's making you feel poorly, it can affect so many things, which is why it's so important to get the right one for you. And what works for Tim isn't going to work for me and isn't going to work for whoever else. Everybody's different. And if you do find somebody that you are on the same antidepressant with, like you said, you've taken sertraline, I've had sertraline, but I can guarantee that we weren't on the same other medications, and we probably weren't on the same strength either.
Exactly.
And it's about trial and error, finding one that works for you.
And
But
to that point, a lot of times with depression comes anxiety, and I mean, like we said last week, they go hand in hand. So you're going to be on medication for both. 9 times out of 10, I would say, probably about accurate. But yeah, anything.
Oh dear. Yeah. I'm just going to read this one. We're going to have a big burp now. There we go. That's Penelope, not Tim. Another reason to keep a journal, you might think you will remember things to discuss, but once you're with the doctor, in your case, you forget things. So yeah, again, journaling helps you remember, like, especially if you're journaling the day and how it feels, like what's going on with you, with the medication, with how you're feeling. Write down any questions you want to ask your doctor when you go to them, and you can take it with you and then ask them so you don't forget things, and then there's nothing to stop you taking it in with you. Asking the questions, ticking them off as you've asked them, writing down what they say even, or take someone with you who does remember, like, because you might have the world's best memory, but if you're in with a doctor talking about your own health, depending on what they mention, I've done it myself, where if they mention something and you're not quite sure what it is, your mind automatically goes on a like in tunnel vision kind of thing, where it's like,
Mm-hmm.
what does that mean? And then
Yeah,
everything else is like, you're not hearing it. You're not, it's all like,
it
you can't
happens.
hear it. Your
It
mind's on
happens on
one
this
thing.
show. It
Yeah.
happens on this show. Like I have 15 things I want to discuss, and I can only remember one because it's just a flood of information that you want to get to in an hour's time, and then we wind up with dead air sometimes because I just can't think of exactly. And that's a great point that by Hattie there. Like we talk about journaling all the time. It just it rears its head again as another positive, impactful thing. And as Espresso said earlier, too many people going to therapists that don't fit them. That's another thing that we have gone over a lot on this broadcast and the other episodes even, is to shop around for your psychiatrist, therapist. All of these things are important. If the first one isn't the right fit, that's okay. There's more. And the health insurance we were discussing earlier is getting better, slowly but surely, for the mental health side of things. So it's important to just allow yourself to take time to feel it out with your therapist. If it doesn't feel like a good fit, you'll know it. You'll know when it is a good fit at the same time. But yes, all very good points. Very much appreciate the chatters and the comments coming in. Makes the show super easy when you guys are into it and we're having good conversation. This one isn't screaming. She should be happy now. But one last thing I had with sertraline, my sertraline, or my Zoloft, is that, of course, when you have a medication that you need to step up occasionally because you grow a tolerance to it, you can't just it's not going to be one that you could just stop taking immediately. I believe that was pointed out somewhere, either in the video or on one of the slides. You can't just stop taking it cold turkey. Like your body has become dependent. The way that an antidepressant works is that it takes you up your brain levels, your serotonin levels and stuff like that. It goes up and then it levels. And if you stop cold turkey, you're going to plummet. So you need, if you are coming off of the medicine, you need to step down just like we were stepping up. Anything to add to that? And I'm going to go put her back in her.
Well, it's like if you just if you stop something, your body's like, it kind of goes into like a shock state where is it? What's happened? Why have you stopped it? And it doesn't know what to do. And it can really mess with your head. I admit to doing that myself, stopping my antidepressants. It was a while back, and I just completely stopped them because I thought they're not working. This is ridiculous. And I stopped them, and oh my goodness, I wish I didn't do that. Where I thought they weren't working, gosh, the effects that I went through, as with any medication, be it antidepressants, be it pain medication, be it for anything, if you've been on it for a long time, especially, even when they're putting you on something, they have to gradually increase the strength rather than just stick you on a really high one. That's to build your tolerance up anyway, but like there's no point giving you say for example 100 milligrams if 50 will do, because eventually they're probably going to need to increase it anyway when it doesn't work. So they need to build it up gradually, as they will need to take it down gradually, because if you just stop everything, your body's just going to be like, why is this stopped? And whilst coming off the medication, you can still have withdrawals from them. They're not going to be as bad as if you just completely stop. And as with anything that you stop, if you are addicted to something, the withdrawals are horrific.
Yep.
As I'm sure you know. But it makes it less if you, this is more with medication than anything else. But if you come down gradually, small steps, then it makes it less and more manageable than just stopping cold turkey. But that doesn't work with everything, like alcohol, for example, or other addictions where there is a need to stop.
Yep.
And unfortunately, as horrible as it is, cold turkey is the only way for some things. But not generally with medication. It's generally best to come down gradually.
Yes,
But
indeed. And that's gonna I'm sorry, Gemma.
Go on. I was just going to say, when you're like having any medication, trialing new ones, it's good to write down, like when you're starting and when you're coming off them, any differences you notice, any side effects, anything like anything unusual, just so that when you go back to your doctor, you can mention it, because you're not forced to remember it.
Sure. And with any medication, there are going to be side effects. That was actually the last thing I had written down. That is just a quick touch on thing. We know that all medicines have side effects. We've discussed that medicines that work for me aren't going to work for Gemma, etc. Especially in the mental health game. This is not a blanket situation. Give everybody this drug. I feel like it's come a long way. It used to be that way. It was, I think Prozac was the only thing out there for a while. It was just prescribed Prozac. But there's so much more going on now in that field, and it's coming a long way. But just talk with your doctor about the side effects, about the potential side effects, what you could experience. As Gemma and Hattie were mentioning, journal it down. Keep a log of everything. It'll make it that much easier when you go back to your doctor and say, this is happening, or everything might be great, and journal that too. This is working, because that's just as important as the side effects or the negative effects. And with the right doctor comes the right meds. If that's your path of travel, if you would like medication, I personally am for the medications that I'm on. They really help me, and it goes a long way for my recovery. Not everybody wants to take medicines, and that is just as good. That is their path, and that's what they do, and it works for them. So in no way, shape, or form are Gemma or myself advocating for medicine. You have the right to make that decision yourself and talk with your doctor, and see what your options are. But definitely, if you are going to go down that path, I would highly recommend scheduling an appointment with a psychiatrist and getting a diagnosis from him as well. Now, that will have to eventually go back to your doctor to be able to do the refills for you. He's going to have to see you as well, but it never hurts to get that first and second opinion, especially when it comes to the brain, because that is your that's your cognitive function there. Your brain is your what controls everything, the nervous system, and it's very important when you go messing around in there, whether it be medication or therapy, can do the same thing. You open. I mean, I was in some trauma discussions when I was at rehab that I felt like they opened my head up and stirred a spoon around in there. So there's a lot out there that other than just medicine. But yes, the importance of medication falls down to what we've discussed. And this is Gemma and I's opinion. Please, if you have anything else to add, we highly encourage you come to our Discord. That's where we are most active, and we have a great community on there. Hattie has been dropping the Discord in the chat throughout the episode, and for that we are grateful. So thank you, Hattie. Well done as always. And with that, we'll go ahead and go over some of our normal community calendar coming up later. First and foremost, let's get back to our own show, the Mental Health Hour special episode, Wednesday, August 31st, end of this month. So you have a whole month to hit that QR code on the broadcast information there, or check the chat if you want to just click the link. Hattie has just dropped it in the chat for you. You can click right on there if you want to do a question right now. Please submit your questions. It's all anonymous, so don't be afraid. We've done 3 of these shows, and all 3 of them have gone off without a hitch, and they are some of our more popular episodes. Gemma and I are off the cuff the entire hour and a half. Sometimes they go, and we're getting hit with all kinds of questions covering a multitude of topics in the mental health field. We'll go ahead and give our shout outs to Ray of Sunshine. He's usually in the chat with us and a longtime supporter of the show. He does broadcasts every Monday, Tuesday, and Wednesday here on Twitch with positive stories and vibes. Check him out. He is usually on, I believe, 4 o'clock and 7 o'clock p.m. on Monday, Tuesday, and Wednesdays. Then, of course, we have our great friend Jim in Chicagoland, who is here this evening. Please join him tonight. I know I've seen his post on Twitter. He is doing Catalyst this evening and every Wednesday. He does not miss. 11 p.m. Eastern Standard Time. That's 8 p.m. out on the West Coast. On Twitch, right where we are right now. Unwind, relax, with a welcoming audience next to a warm candle. Talk about anything and everything. He does not discriminate, and he keeps it fun and light. Eric was on our show a few weeks ago. Eric J Gaming, he's also in the chat this evening. He does a Twitch stream every Monday at 7 p.m. Please check him out. Also, the Beardo and Weirdo show. They are back. Wilson, or Weirdo, was out on the road all summer, so they haven't been streaming as much. But I believe as of last night, they were back. I did not get to see it because I was at work and we were busy. And finally, you know her, Ella the Bunny Mom. She's made just about every single one of our episodes on here.
Yeah.
For everything, bunnies and rabbits. I like saying rabbits, but she likes bunnies. Go to mybunnyvalentine.com and use the promo code FireDude15 to save 15% off of all of your purchases. Ella's a great longtime supporter. She's been on the show as well, sharing her experience, strength, and hope with all of us. And she streams every night here on Twitch as well. Not every night, but most nights here on Twitch with the ukulele and some songs and Puppy Cat, her bunny rabbit. She has made it her mission to rescue all bunnies in the world, all of them. She wants to rescue all of them. So help her out and visit her store there, mybunnyvalentine.com. There's all kinds of goodies, good kids' gifts, and gifts for yourself and for your desk right here. This is a Bluetooth speaker. Connects right to your iPhone.
I have one of those.
Yes.
Not this one, though.
So that is all we have, guys. Thanks for joining us on this 2-part episode. I think we got it in pretty well tonight. Penelope is going to make her presence known.
Sure.
That being said, we're going to go ahead and get on out of here. And Gemma, did you have anything before we do leave?
No, I don't think so. Oh, yeah, really quickly about the podcasts. It was mentioned earlier.
Oh, sure.
And I've got my computer back now, so I'll be uploading some more. Obviously, we're on episode 60, so it's going to take me a little while to upload them all, but I am going to put them across. They're going to be on Anchor, Spotify, Google, Apple Podcasts. I'm trying to think what else I've missed. Said Spotify. All the major ones anyway. But if by any chance you use a particular one that I haven't said, do let me know, and I'll see about popping it on there as well.
Alrighty.
But
Thank
yeah,
you.
we're on everything.
We'll get that moving for you guys. And as always, check our bio link for everything mental health hour related. We appreciate you being here. We're going to raid former guest Sarah Lightman tonight. She is on singing. So go give her a follow, give her some love from the mental health hour, where she was nice enough to do an interview with us. So we're going to send her over to you guys, and we'll see you guys next week.